All right, so ABG interpretation. So we'll do the next slide, and then you'll split up and do some review of your, or do some ABG practice. Okay. All right, so three-step analysis. How do you analyze an ABG? Well, the first thing is always look at pH, because that tells you if you're what? That tells you if you are acidotic or alkalotic, right? So step one is the last step, right? It's three different lines, right? You're filling in the blank, three different blanks. The first blank you're filling out is whether it's acidosis or alkalosis, right? So step one is, what is the pH? 7.32 is what? That's acidotic. So my final answer, right, is acidosis. What kind of acidosis? That's the next step. And the only two options are respiratory or metabolic, right? So you have to look at this like an algorithm, because if you try to memorize all the different steps, like you try to memorize that table there, you're gonna have a really tough time, right? You have to think of it sequentially into an algorithm. Just like when you study AV blocks, if you learn it as an algorithm, you're good at it every single time. If you try to memorize all this, which one's irregular, which one's this one, which one's that one, it's much more difficult. Okay, so the first step, acidosis or alkalosis. Second step is what caused it, right? So if the CO2 caused it, that's called respiratory acidosis or alkalosis. If the bicarb caused it, that's called metabolic acidosis or alkalosis, right? So you're trying to look to see who caused it, who was it, right? Who did it? So if you look to see which one is acidotic, which one's alkalotic. So which one is, the CO2 or the bicarb? Do we care about the PO2? Don't care, not at all. All right, CO2 bicarb though, which one of them caused that pH to be 7.32? Which one caused it to become acidotic? That CO2 did, right? That CO2 is 49, the bicarb is 29. Bicarb's a base, and you have too much base, you're too alkalotic, right? Or you have a really cool sound system. But either way, we have a CO2 that is that's on the acidotic side, right? Too much carbonic acid, too much CO2 circulating around. They are breathing fast or slow? They're breathing slow. They're hypoventilating. They might have any one of those other reasons that cause hypoventilation, right? So that's what caused it, right? So you have respiratory acidosis. The third step is only used in academic centers like Antelope Valley College. So that's the only thing you use, and there's really not much utility clinically for this third step, and it's probably the hardest one, is where you say, is it uncompensated, partially compensated, or fully compensated? It's like, I don't care, they're sick, I'm gonna fix it now. I know what the problem is, I know what caused it, I know how to fix it, let's go, right? But really, if you wanted to officially, give this a first name, Mr. or Mrs., you're gonna say, you look at the other value, right? You look at, so we said CO2 is used, check. pH is used, check. Now we're left with the bicarb. We're gonna analyze the bicarb. And the bicarb in this situation, did it try to fix the problem? Did it try to fix the acidosis? Are the kidneys working, right? In this case, if it was a metabolic problem, we look at the CO2 and are the lungs working, right? In this case, the CO2 is high, and we expect the bicarb to do what? To try to compensate and try to fix that pH, right? So how does a bicarb fix a low pH? It holds on to it, right? And it's going to add more bicarb to the situation, trying to bring the pH back within range, right? So the bicarb should go up if it's working, right? So did it go up? Yes. Did it fix it? No. So that's where we look at, is it fully, partially, or uncompensated? If it's the only reason why you would have fully compensated, the only reason you would write fully compensated there is if the pH is normal. Okay? So usually the pH is normal and the other two values are abnormal. You have fully compensated, whatever, right? So now we're just torn between uncompensated and partially compensated. So how do you tell if it's partial or uncompensated? Well, you have to look at the bicarb. Did it actually do anything? Did it get off its butt to try to fix this problem or not? If it didn't try to fix the problem, it is uncompensated. If it tried to fix the problem, it's partially compensated. Okay? So basically, if the two values are abnormal, right? The CO2 and the bicarb is abnormal, that means you either have a fully compensated or a partially compensated ABG. How do you know it's partial or full compensation? The pH, right? The pH is normal, fully compensated. pH is abnormal, bicarb didn't fix it yet, it's partially compensating. Okay? Any questions on how that works? You have to think of it algorithmically, because otherwise you're just going to be referring back to a table, it's not going to help you as much. Okay? So you have to look at, first step, what's the pH? Second step, what caused the pH to be that way, and third step, did that last value, the other value that's left over, did it try to fix the problem? If it fixed it and the pH is great, that's called what? Fully compensated. If it tried to fix it but did not fix it yet, the pH is abnormal, that is called partially compensated. If it did do nothing, it's like, huh? Right? And it's like, what do you mean to do? What? Right? That's called a lazy spouse. No, I'm kidding. So it's called a uncompensated. All right, so let's do some practice. All right, so who has number one? What happened in number one?
What may have caused this?
So let's for the back of the room and the others, let's just walk through it real quick. Not anybody in the back of the room doesn't understand. I'm just saying.
Whoa.
That's not pointing fingers. So bicarb and pH, right? So you're saying metabolic acidosis. You're saying the bicarb caused the problem, right? So what's 7.25? That is acidosis, right? And what caused it? Was it the CO2 or was it the bicarb? It's the bicarb, right? So that was acidotic. You can fill them out every time. Alkalotic, acidotic, right? So did the alkalosis cause the acidosis? No, the acidosis caused it, right? So that's metabolic acidosis, right? And is it compensated, partially compensated, or fully compensated? Or I should say partial, full, or uncompensated. So did the CO2 get off its butt to try to fix it? Did it fix it? So that's called partial compensation, right? So partially compensated means that there's a change in the other value, right? But it did not fix the pH. If the pH got fixed, that's fully compensated. If the pH did not get fixed, that's partially compensated.
So if their numbers are off the charts, that means that it's trying to do something.
It's trying.
Okay.
All right, so what's a possible cause? Two possible causes. Infection, so they got a lactic acidosis, lactate brewing. What else? Diarrhea, they're pooping out bicarb. They're losing bicarb, right? The PO2 being 60 makes me think it might be like a respiratory infection, right? So that's probably leaning towards that, right? So septic shock, you got pneumonia, right? They got DKA, they got renal failure. All these things are acid production, right? Acid contributors. And I didn't ask you how you fix it. So how do you fix infection? You give antibiotics and fluids. How do you fix, what did you say? You said DK or no? You said potassium sparing diuretics? What did you say? I forgot. I have a goldfish memory apparently. What do you? Diarrhea. That sounds like diuretics. So diarrhea. So we're going to give you some diarrhea. All right. So diarrhea will cause what? The loss of not hydrochloric acid. That's vomiting. Will cause bicarb loss. Right. So how do you fix diarrhea? You avoid room temperature sushi, and also you give antidiarrheals. Do antidiarrheals cause QTc prolongation? Yes. Negative. Antiemetics do. Okay. All right. So in this situation, if they have pneumonia, oxygen will work as well, right? All right. Number 2. What is pH? This is acidic or alkalotic? This is alkalotic, right? And you can just answer each one first. So CO2 is that alkalotic or acidotic? That's alkalotic. What about the bicarb, 23? It's on the acidotic side of normal, right? So you can say acidotic, right? It's also normal. Just put normal. All right. But remember, 24, you can't tell. If it says gives you a bicarb 24, you cannot tell if it's acidotic or alkalotic, right? So it's 24 plus or minus 2, right? So what caused the pH to be alkalotic? This one, right? The one that lines up, right? So step 1, step 2, take care of. What about step 3? Partially, fully, or uncompensated. So it cannot be fully compensated. How would it be fully compensated? The pH would be normal, right? So now we have to decide, did the other number try to fix it? No. Did it not, right? So it was unmotivated. So we have a uncompensated, unmotivated respiratory alkalosis, right? So 2 causes. Why is someone breathing fast? So hyperventilation is not an appropriate, yes, it's a cause, but it's kind of more like a reason. And what made that happen? Why are they hyperventilating? Pneumonia with PO2 at 90? Probably not. Anxiety, right? Exam 1 on Monday, right? So that's causing respiratory alkalosis, right? What else? Another cause of respiratory alkalosis is stress, pain, right? Fever, right? They have an you could say infection, but usually infection, again, is one of those spectrum things. Like early infection could cause respiratory alkalosis, but once you start getting development of lactate, now you're starting to head to metabolic acidosis territory. All right, treatment. How do you fix exam 1 on Monday? Don't look up the drop by date. How do you fix the stress? You study. You do those things. How do you fix pain? You give analgesics. Don't give too much pain meds. Otherwise, what happens? They stop breathing, and they get respiratory acidosis, right? So what do we have here? Hyperventilation, anxiety, pain, distress, an asthmatic, breathing really fast, right? So how do you fix it? Decrease respiratory rate, anxiolytics, antipsychotics, pain treatment, right? All right, number 3, what do you got there?
Acidosis.
So it's acidosis. What about the PCO2? Is it acidosis or alkalosis? That's also acidosis. The bicarb is also acidosis. What the heck? So we got a mixed acidosis. This is a fancy ABG. You're not going to be tested on this one, but it's a fancy ABG where you have 2 at the same time. Does it happen in the hospital? Absolutely. It happens all the time. That's where they usually end up in the ICU or they end up coding, right? So we do have to be alert to these things, right? So what came first? It's kind of hard to say what came first. All right, which one happened first? So maybe they had sepsis, they had a lactate buildup, or they had DKA, ketone buildup, right? Or they have kidney failure, hyperkalemia, and they say, I'm in pain. Well, shoot. Now they're hypoventilating and have metabolic acidosis, right? So that's usually the likely cause. And you cut off their compensation. You cut off their ability to compensate. All right, so what I put here, so we got hypoventilating septic patient. They got found down with emesis. They aspirated. They got PO2 is 45. They got some lung process, right? Found down. They had a neuro injury, right? And they were not breathing. And then all of a sudden they aspirated. Now you got an infection on top of that. So that's going to be bad, right? So they likely need to put on a mechanical ventilator so we can, take the wheel, and we're going to try to fix it as best we can. Okay. All right, number 4. What is 739? Normal, but you could put down acidotic side of normal, right? PCO2 at 30, what is that? It's alkalotic, right? You can't take that one back. All right, so they're alkalotic. Did the alkalosis cause the pH to be on the acidotic side normal? No, it'd be 741 if that was the case, right? So the bicarb, did that cause it to be on the acidotic side normal? Yes. This looks like a after situation, right? Because the pH is normal, but the other stuff's abnormal, right? So that means it got fixed. Who fixed it? What happened first? Is it metabolic or respiratory acidosis? It's a metabolic acidosis. Bicarb is acidotic, right? That's the one that caused this problem, right? So you have metabolic acidosis. The CO2 fix it? It did a great job. It fixed it. It absolutely fixed it, right? So that's a compensation, right? Of what variety? Partial, full, or un? That's a full compensation. Yes.
Do you need to treat fully compensated things, or
looks like your body fixed it, or you gave the fix already, right? So yeah, what might have been the cause of this? What might have been the cause of a metabolic acidosis? It could be DKA, something that'll kill you, right? It could be something fancy like something GI. What kind of GI process would result in metabolic acidosis? Vomiting is throwing out hydrochloric acid, right? So that's a loss of acid. We have a gain of acid because we lost bicarb via diarrhea, right? So it could be that. PO2 is fine. I don't think that's maybe a lung process. You could argue be a lung process. All right. So the body's compensated at this point, and maybe they're sick and distressed. They're breathing fast, but they might give up. Right. They can't breathe fast for forever. So we have to be alert to that and try to fix the underlying problem. If we said diarrhea, we give antidiarrheals, replace fluids. Right. If they have an infection, right, we can fix the infection, fix the ketones, etc. Okay. Treat the underlying cause. If they have hyperkalemia, for instance, we can fix it with a potassium cocktail. All right, number 5. What is that? pH. That is acidosis. What about the CO2? That's also acidosis. What about the bicarb? That's normal on the alkalotic side, right? So, what is it? Uncompensated respiratory acidosis, right? If that bicarb was 27, we would be partially compensated, right? So that means the bicarb is going the right direction. All right, what might cause respiratory acidosis? Decreased breathing because they had what happen? They had what? They overdosed on narcotics. How do you fix an overdose on narcotics? You can put on a mechanical ventilator, or you can give a reversal agent such as naloxone for what narcotic? For an opiate, right? If they overdose on a benzo, what would you give? Romazicon. Okay. All right, number 6. What is number 6? What is that pH? That's on the acidotic side of normal, right? And what about the the CO2? That's also acidotic. What about the bicarb? Definitely alkalotic. PO2 is a little bit low too. It's concerning. Might be, but they have what kind of ABG? They got a fully compensated respiratory acidosis. What would make that partially compensated? pH was 7.34. It would be partially compensated. But now that the pH is 7.35, it's fully compensated, because fully compensated only happens when the pH is normal and the other values are abnormal. Okay. What might cause CO2 to be 52? Asthma, it'd have to be like an obstruction, like they're having no CO2 leaving their body. Right, severe asthma. This also could be just a COPD patient. COPD patients, emphysema patients, they live at a high CO2 level all the time. Okay, so what's the next one? Number 7, 7.34. That's definitely acidotic side of normal. So it could be just a normal ABG or fully compensated. That does not look like a normal ABG. So CO2 is what?
Acidic.
That's also acidotic. What about the bicarb? Also alkalotic. So what caused it? Was the CO2. That means it's a respiratory metabolic problem. So that's a respiratory acidosis. What flavor?
Well, so I thought 35 to 45 was the normal range, so I put partially compensated.
So 35 to 45 is for the CO2, right? So the CO2 is what caused the problem. So now we're looking at the bicarb. So 22 to 26. So we are normal or outside of normal?
We're outside of normal.
So that means we tried to fix it. Did we fix it?
Yes.
No. We're 7.34. If it's 7.35, we would have fixed it, right? So it's partially compensated. It would be fully compensated if that pH was 7.35. That'd be the only difference. Okay, what's a possible cause of respiratory acidosis? Good, myasthenia gravis. You got a neuromuscular problem. You got a CNS lesion. You got a comatose state. You have someone found down, right, not breathing. All right, how do you fix myasthenia gravis? You backed yourself into a corner, didn't you? Yeah. So acetylcholinesterase inhibitor, cool. All right, but you fixed the underlying problem. Okay, all right, so 8, what is that? Good, alkalosis. What caused it? Was it the CO2? So you kind of want to answer each one. So CO2 55 is high, which is acid. So that's not what caused it. So it's probably the other one, right? Something caused it. It was either the CO2 or the bicarb. If you can't remember, right? You can't remember which one's which, right? So the bicarb of 40 means That's alkalosis, right? Normal bicarb is 22 to 26. Greater than 26 is more bicarb, more base, more alkalosis. So we got a metabolic or respiratory problem. Metabolic alkalosis, right? And is it partially or fully compensated or uncompensated? So why is it partial and not uncompensated? Because the other one's trying to fix it, right? We're breathing super slow to try to fix that alkalosis, right? So what might cause you to have this really severe metabolic alkalosis? Vomiting hydrochloric acid will leave more bicarb, yes. What else? Potassium wasting. So that means you have hypo or hyperkalemia. Hypokalemia, right? So how do you fix hypokalemia? Give potassium or give medication that will acidify the bloodstream, which is what medication? Acetazolamine, right? Diamox is the brand name. So those are the medications. So we got someone vomiting, or we got someone that has the they have an NG tube and it's suctioning all of the GI contents out, right? What GI contents? The contents in the stomach, which have hydrochloric acid. All right, number 9. Who has 9? What is 717 pH? Acidosis. And then which one of these is acidosis? CO2 or bicarb? CO298 is definitely greater than 45, and CO2 is an acid. More acid means more acidosis, right? And then bicarb at 38, what is that, alkalosis or acidosis? That's alkalosis, right? So what caused it? Was definitely the CO2. So what might have caused the CO2 to be 98? Overdose, right? They overdosed on something, they got a narcotic. What's another reason? Like a severe pneumonia, like that PO2 is 40. That's not good. Someone's not breathing, right? It could be just someone that's found down, someone has a stroke, and they're down and no one checked on them. And someone did check on them in time, and now the ambulance came, and they did an ABG at the ER, and they found the PO2 so low because they were not breathing, right? So how do you fix someone that's not breathing? You breathe for them, right? You put them on a mechanical ventilator, you do intubation, right? Especially like gas like that. That's a really bad ABG. All right. So what else? We got number 10, 724 pH. Acidosis, right? What caused it? CO2 at 36 is what? Normal, but on the what side? The alkalotic side, right? CO2 is an acid, right? So it's on the normal side, but what did the bicarb of 16? Is that acidotic or alkalotic? That's definitely acidotic. That's what caused it, right? So did the CO2 try to fix it? Nope. So that means it's what? Partially full or uncompensated? That's uncompensated. What would make that CO2 change this to a partial compensation? CO2 was not 35, but 34.999 repeating, right? That would make it, the CO2 is 34 or less than 35. That's going to be a sign, that'd be partially compensated, right? But this is uncompensated because the other value is normal. It has not fixed it. What about a cause of this? Diarrhea, we're pooping out bicarb, good. What else? Increased ostomy output, good. Those are interchangeable. So how do you fix increased ostomy output? You have an antidiarrheal of some sort, right? All right, next one, number 11. So 736 is, that's normal, but it's kind of on the acidotic side. What about CO2 at 37? It's also on the alkalotic side, right? But normal. What about bicarb at 21? That's on the acidotic side. Is it normal? No, that's acidosis, right? So what caused that drop in pH? Was the bicarb. So that means it's what kind of acidosis? A metabolic acidosis, and partially full or uncompensated. It's kind of tricky because what are we talking about, the beginning state or the end state? If this is the end state, yeah, it's fully compensated, right? Really, if I would give this as a test question, I would probably give the CO2 would be lower. This could be at the early stages. The bicarb is going to start going down and down and down, and then now the CO2 needs to fix it. Okay, so the PO2 is 210. Is that good? That's too high, right? So what caused this? What caused you to become acidotic? Metabolic acidosis, right? It could be DK. What else? Sepsis, like lactate buildup. It could be, what else? It could be potassium that's going up, right? You have hyperkalemia. How do you fix hyperkalemia? You can give a potassium sparing or wasting diuretic. Potassium wasting diuretic to lower the potassium level. How else do you fix the potassium? Fix it with diarrhea? No? What else? If they have EKG changes, what would you do? It's usually going to be calcium to fix it. What else can you do to fix potassium? You can give what medications? Insulin and glucose, right? Those are the ones you give. All right. All right, so what about 12? What's that?
Quick question.
Yes.
Is that fully compensated?
Fully compensated? Well, I just put compensated, didn't I? So yeah, we can't really tell until we have, if the pH was, if the CO2 was 34, we could say it's fully compensated.
So just
Yeah, so really that's not really a interpretation. That's why in real life it's not, it's not 100%. Okay, so yeah, it's in the pH 734 is. All right, acidosis for sure, not normal. CO2 of 41 is good. And bicarb 25? Good, we're on the alkalotic side, right? So what's causing this? It's probably the respiratory piece, right? The respiratory piece is causing this to start going down, right? In real life, is this going to make it 734? Probably not. But this is just an example. Like in real life, you will see other things. If it's 7.35, this would be what? Absolutely normal. So if I change it to 7.35, that's a normal ABG. So it's starting to get abnormal. Would a CO2 of 41 drive it that low? Probably not. There'll probably be something else going on. Okay. So it just for fun time's sake, what causes respiratory acidosis? Could be some asthma, good.
Could be an opiate overdose, but that would probably be.
Yeah, just a note with asthma. Anytime someone with asthma has respiratory acidosis, it's a medical emergency, no matter what. They should always be respiratory alkalosis. They should always be breathing fast, right? Not because they're in distress, but because they have bronchoconstriction, and that's going to lead to a hypoxic state. And anytime they have respiratory acidosis, like this was an asthmatic, this would be a medical emergency, and they should be, intubated and, escalate as much as possible. Okay. So this is like a normal ABG, but that's like, I think I would change to 735 if I really wanted you to say it's normal. All right, 13, what is that? Definitely alkalosis. What's causing it? Well, bicarb is alkalotic. Is CO2 alkalotic? Yeah, this is called a mixed alkalosis. So you have two things caused. This is just an exercise. You're not being tested on mixed acidosis or alkaloses, but it's to get you thinking about the material. So what could cause this? Well, why would someone have both? What if someone's breathing fast and has diarrhea? Sorry, not diarrhea, but have be vomiting, right? Someone's breathing fast and has vomiting, right? They throw up on exam 1 on Monday, right? So they might have a mixed alkalosis on their hands. Hopefully not on their hands. All right? So mixed alkalosis. Okay. So what else? We got ABG results of 747. What's that? So this is alkalotic. And then what caused it? Is this alkalotic, bicarb? 20? No, 20 is acidosis. So there's another trick. This is actual a real ABG you should interpret. So that's acidosis. That means the other one's alkalosis. And that sure is, that checks out, right? Less CO2, less acid means alkalosis. So they're doing what? Breathing fast or slow? They're breathing
No,
fast, right? Breathing fast, so why are they breathing fast? You have an SNS response to breathing fast because anything in the SNS. You got low pH, low oxygen, low glucose, any one of those things making them breathe fast. And we got to fix the underlying cause. Fix the O2, fix the pH, fix all those things. Now pH can go both ways, right? pH is, in this case, usually when pH is low, well, the low pH is not triggering this SNS response, right? This is probably one of the other reasons. Are they dehydrated? Or they have a low blood sugar? Do they have a hypoxic state? PO2 of 81 is not terribly hypoxic. All right. So number 15, 698, is that acidosis or alkalosis? Very acidotic. All right. What about CO2 of 28? That's alkalotic. All right. Bicarb of 3. That's probably what caused it. Just a hunch, right? So that's caused extreme acidosis, right? And what would cause extreme acidosis like that? With an O2 that might be normal, probably not a pneumonia, but probably could be severe diarrhea where you're pooping out bicarb. What else? Usually, it's really hard to get that low for just diarrhea. But you're adding acids to the solution, such as ketones. DK patients commonly come in like this, right? They have extreme acidosis, right? They think they're usually younger people and they can tolerate these extreme changes, right? So they have a severe, what kind of acidosis? Severe metabolic acidosis. Is compensated? Is it fully compensated? Absolutely not. Is it partial?
Partial?
Yep, partial compensation, right? The CO2 is trying to fix this extremely acidotic state, right? So how do we fix DKA? It's FIE, fluids, insulin, and electrolytes, right? What about 16? What happened at 16? That's the same thing, right? Acidosis, but now the CO2 is 92. What happened? There's all acidosis, the whole thing. That's mixed acidosis. This is a real patient, actually. Patient DK, they have abdominal pain. It's like, I need some morphine. Okay, morphine. Now what happened? Now they're not breathing, and the CO2 gets added to the equation, and that's going to lower the bicarb even more, and that's going to drop the pH even more, and this patient had a cardiac arrest because of that, right? So they can complain of pain meds, but is it safe to give pain meds? So as the RN, you're the one in charge. You're the one that has to decide that, right? And it's going to be you on the stand that says, compared to a normal practice nurse, would you give this to someone who had a pH like this and severe metabolic acidosis? Their only compensation is their breathing. And am I going to add something that's going to make them not breathe? Probably not. Okay, but they're in pain. But you could use what? Cognitive behavioral therapy. Use guided imagery. Imagine you're on a playground, right?